Hi, Stream Team. You might notice that I am solo today. Dr. Pizzona is not here. He's not even in the building. In fact, I am taking over the entire podcast to talk about some women's issues with one of the amazing team members of Pizzona MD, Dr. Brooke Faught, a doctor of nursing practice. So if you're ready to go deep, let's do it.
Balls deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in.
So, as we said, Dr. Pizzona is not here, and it's just me, Kat Williams, and Dr. Brooke Faught. And we are going to talk about a women's issue today that I think a lot of people are going to be interested in. I'm going to read it from the paper because it's a technical term. Hypoactive sexual desire disorder. Brooke, what does this mean?
Yeah.
What is this?
So hypoactive sexual desire disorder, as we refer to it, HSDD. It's a little bit easier to say.
Okay, that's a little bit easier. HSDD.
It's also easier to type in medical records, so
much easier.
We tend to use that term. Essentially, we think of low libido, right? Low libido is more of a symptom, though, and it doesn't always constitute a diagnosable condition or something that needs or warrants treatment. So, for instance, somebody may come in and say, I don't really desire sex. I don't really want to have sex. But it may be because they just had surgery or their partner is really stressed out or, a lot of different reasons.
Really rather watch Netflix. I mean, Yeah, it's a symptom, but not necessarily a disorder. If you have low libido.
Yeah, maybe it's not bothersome, or maybe there's an explanation. Maybe it's a situational scenario, and we expect that it's going to resolve in a period of time. So lots of different situations where we understand why it's happening, and it may change, for instance. And so in that situation, there's no reason to diagnose and intervene or give a medication or begin sex therapy or whatnot. That's, again, the symptom of low libido. When the patient comes to me and says, I don't know why this is happening. It's been going on for months now. Something really changed. I used to have this not even a really strong, but I used to have a better sex drive.
An interest, more of an interest?
Mm-hmm. Okay. I desired it. I thought about it. I had sexual dreams. I was more receptive either to my partner or to the idea of sexual encounters, and something shifted, like a light switch went off. That's what tells me that something's different. And it's bothersome. So there's got to be that factor of bother or distress associated with it. And they desire to have a change. So they want to seek treatment. They want to have some type of improvement. And in that case, they're a candidate for treatment. So in that case, we talk about the different options. And we'll talk about that in one of our next segments.
Okay. But so just to reiterate again, so when we talk about low libido, of course, I'm at a certain age at this point, 29. Not really, not at all. That's a lie. Women talk about low libido, but mostly I hear them talk about what you've just said. It's a lack of interest. Mm-hmm. But there's a difference between a lack of interest and a diagnosable condition. Mm-hmm. Is that correct?
Yeah.
And so the difference in the diagnosable condition is it's something that has changed.
Mm-hmm. Yes.
Rapidly? Yep. Or over time? How much time?
Usually about 6 months. You know, when we look at the DSM criteria, we take into consideration timing, and technically it's 6 months. However, I look at my patients individually and consider with regard to the entirety of their symptoms, their history, their relationship, and so forth, as to whether or not I think they're a candidate for intervention, whether it's medication, sex therapy. I really want to consider the entire biopsychosocial realm. Again, taking into consideration how bothered they are, how motivated they are. Some of my patients really are not incredibly bothered or impacted by their symptoms, and other women are at the point of worried that their relationship is going to break up. And so in that case, it's incredibly impactful, and treatment is going to be more important for them than maybe somebody that comes in and says, yeah, it's a side note. I'm really here for another reason, but it is something I wanted to talk about.
Okay, so I think we should just get into the nitty gritty of this because I feel like most women experience, in the same ways that men experience erectile dysfunction and they don't talk about it, I think probably a lot more women are experiencing low libido, whether that's a diagnosable condition or simply kind of a lack of interest. And people are not wanting to talk about this.
Yeah.
Does this have anything to do with age? Do people experience low libido in their 20s, or is it simply something where women begin experiencing this in their 40s, 50s, 60s? Is it an age-related thing?
Yeah. So I see women of all ages. And what's interesting, there have been numerous studies looking at women experiencing sexual complaints. I will say that distressing low sex drive, or HSTD, occurs more than all the other sexual complaints, including arousal disorders, orgasmic disorders, and even pain. And it occurs in all ages. But we tend to see distressing low sex drive kind of in that middle window, so kind of like middle age. However, again, I see women of all ages for lots of different reasons that report low libido. For instance, maybe younger women that come to me, maybe they're less experienced. They're, say, newly partnered, newly sexually active for the first time, and they're not super familiar with their bodies, maybe not quite as comfortable as an older woman or more mature women like ourselves.
We're mature.
29,
That's right.
mayet compared to the 25-year-olds.
Right. We're very mature 29.
Wink.
Wink.
Whereas maybe somebody that is closer to we'll say somebody that just had a baby and they're tired, they're not sleeping well, they have more obligations, they're giving of themselves more than they used to. Then we have somebody that's going through menopause. There's a lot of body changes, hormone changes that they're getting used to and experiencing. Then there's life changes where patients are losing their partners and family or parents are passing away. I mean, just lots and lots of different situations that tend to occur both physically as well as, socially and in different realms of the individual's life that can impact both physical and emotional receptivity to sexual encounters. And we have to take that into consideration when we figure out what exactly is the potential cause for this individual's sexual concerns.
So this may be getting into more. We're going to talk about treatments a little later, but how would you differentiate something that is low libido of something that's actually being diagnosed versus something where you're just not that interested? Maybe you were interested and you're not that interested anymore. Maybe you have not zero interest, but definitely you can look back in your life and say, well, 10 years ago, I felt differently. 10 years ago, I definitely felt differently. I'm at a different place in my life. Maybe I've been married for a while. Maybe I've been with a particular partner for a long time. How do you know when low libido becomes something different? Becomes something that is actually a diagnosable condition.
Yeah.
Because I've never heard that. I mean, I've heard women talk about not being interested, having low libido, but I've never heard about it talked as though it was an actual diagnosable condition.
Yeah. There are what's called validated questionnaires that people can take, and it's a little bit easier to utilize these questionnaires in a medical setting with a trained healthcare provider so that they can review these with you and explain what the meaning is behind them. But I tend to use the Female Sexual Function Index, blah, blah, blah.
Okay. I didn't even know this is a thing.
Right.
The Female Sexual Function Index?
Yes, FSFI.
What is that?
So this is a questionnaire that an individual can fill out, and it has multiple different domains, and it breaks down different categories to tell me, does the patient have any complaints in the domain of low libido or just sexual desire, arousal, orgasm, pain, dryness, etc.? Then I can also have the patient fill out a questionnaire with regard to distress. So are they bothered by these complaints? Because again, patients may have problems associated with all of these domains, but they're not bothered by it.
Well, they don't care.
Right.
Okay.
Right. It doesn't impact them. Like, sure, I have some dryness and I don't really desire sex, but it's just not an important aspect of my overall, quality of life and so forth.
Okay.
And if that's the case, I might keep it on my radar for the next time I talk to them, but it's not something that we're going to address or intervene upon at this moment. And then there's the DSDS, and that can be a little bit more specific with regard to sexual desire. And there's a whole slew of other more specific questionnaires too. So that's something that patients can also kind of toy with if they're a little bit more savvy with navigating the internet within reason. I always caution people to, Google their symptoms or to utilize the internet to, self-diagnose or to seek treatment. But at the same time, if they feel comfortable and they're familiar with some of these questionnaires, they can be helpful tools to begin the process of conversing with their healthcare providers.
Is this normal? Is this something that happens to every woman at some point or not necessarily?
Mm-hmm. It's a good question. I would say common. So, upwards of almost 50% of women, I say almost, about 40 to 50% of women report distressing low sex drive at some point in their lives. So common, but I don't want to say normal. I also don't want to say abnormal because that makes it sound, women think, oh my gosh, something is horribly wrong with me, or I'm broken, or, something is weird about me, right?
Right.
I do think that we do need to normalize conversations around sexuality. So I hate to use the term normal or abnormal in that regard, but at the same time, I also don't want patients to think that, that they can't come in and talk about these issues. It is unfortunate that a lot of healthcare providers are not familiar with these, a lot of terms, a lot of conditions, a lot of treatments that are available. And so healthcare providers oftentimes will not bring up these topics, these conversations. And then patients don't feel comfortable bringing them up either because they're afraid they're going to embarrass their provider or that there's nothing available anyway. So why bother bringing up the conversation? Right. And so it just, these issues just stall in the exam room, unfortunately.
I feel like that's a little bit more weighted in the unfortunate zone for women than it is for men. Mm-hmm. Even though men are a bit, not thrilled to talk about something like erectile dysfunction, they want to get it fixed.
Yeah.
And so they're willing at some point in the privacy of a visit with their doctor to talk about it. But I think maybe that's not always true of women.
Yeah. A broken penis stops the world, right?
Doesn't it?
Yes.
How intriguing. But yet, women's sexuality, women's pleasure, women's mm-hmm. interest in sexual performance is not taken as seriously, even by healthcare professionals?
Mm-hmm. Yeah, okay. I think that we are, as women as a whole, we are somewhat trained to keep going no matter what. And
for sure,
if there's something that's not quite working to our preference, we just put on our, no pun intended, big girl panties.
Our big girl panties.
And we just keep trudging forward, right?
Absolutely.
And put that smile on while you're doing it.
Right. Mm-hmm. Well, Brooke, we're going to talk about a little bit more because apparently there are things to do for this, which is another thing I've never heard anything about. I've never heard that there was an actual medication linked to improving a woman's libido. But you and I have talked actually privately, and I learned a plethora of things I didn't know existed. Mm-hmm. But is there anything more about just a general understanding of low libido or this hypoactive sexual desire disorder that you think we should know as the public, since no one's talking about this?
Yeah. There is, we'll get a little bit more into the treatments, but there is a big discrepancy in the kind of the process with how medications and research is handled in the United States, especially with regard to male and female treatments and medications.
Oh, it's not the same?
No.
Isn't interesting?
Isn't that wild?
Wild.
For instance, Viagra was expedited through this very speedy process through the FDA, 6-ish months, whereas the first ever medication to reach FDA approval for women for hypoactive sexual desire disorder, it took years and years and years for it to gain approval.
6 months versus years and years and years and years.
Yes.
Oh, isn't that interesting?
And we heard about Viagra. The millisecond it was on the
4
market.
4 minutes later.
Right, exactly. Right. Whereas it's been 10 years since the first medication hit the market for HSDD.
It's been 10 years?
And you have not even heard about it, right?
No one's heard of it.
Yeah.
I'm married to a doctor, and I have a father who is an OBGYN. I've never heard of this.
Yeah, it's unfortunate.
That is unfortunate and sort of remarkable. Mm-hmm. Okay.
Yeah.
But low libido, anything else we need to know? And I'm not setting this up especially well, but there's a difference. I guess the best thing to leave with is there's a difference between a lack of desire that happens to many people, maybe not everyone, but many, and then an actual treatable disorder. And you've got to work with your healthcare professional to figure out which is which.
Yeah, for sure.
Would you ever treat, this is probably part of our next podcast, but would you ever treat simply a lack of desire?
If a patient came to me, okay, so let's say a patient came to me and said, I really hate my partner. I'm not attracted. I used to desire sex, but now I'm just, my partner annoys me. I don't like the way they sound. I don't like the way they smell. I don't like da-da-da-da-da. Can you give me a pill to make me want to have sex with them?
That sounds like a little bit of a different problem, Brooke.
Exactly.
Okay.
Exactly.
Okay, fair enough.
So they're bothered by their low sexual desire, but it's not, what I'm hearing is it's not a chemical issue like traditional HSDD, right?
That's a partner problem.
That is a situational low libido. And so in that case, that's where I'm going to suggest a different treatment approach. And so that would be a whole nother treatment algorithm.
Whole nother ball of wax. Okay. Well, stay tuned, everybody. We're just getting this conversation started. We're going to talk next time about treatments and what we can actually do to treat the hypoactive sexual desire disorder, HSDD. And apparently, there are treatments out there that we've never heard of. No one's ever shared with us. So stick around. We've got some more stuff coming. She has, but she's a doctor. She's a doctor. And she told me about them, and I'm going to tell you. Okay, thanks for sticking with us, Stream Team. And we'll be back in another episode, and we'll try to behave in our female sexual health discussion.
No, we won't.
She says no, we're not going to. See you in a minute. Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream Team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizona MD, please visit PizonaMD.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.